Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Amir and I am working as an associate professor in the pediatric department of Isra University, Hyderabad. I would like to congratulate all the administration of 18th Biennial Convention PIMA Sindh 2023. So I am the moderator of this session, and in this session we have 3 presenters and we have 3 chairpersons for this session. So before inviting our first presenter, I would like to invite our chairpersons. First of all, we have one of the leading cardiologists in the Hyderabad, and currently he has been working as a Vice Chancellor, University of Modern Sciences and Tandamawat and the Principal Indus Medical College. Professor Feroz Mehman, sir, please come on stage and have a seat. And our second chairperson, one of the few good nephrologists working in Hyderabad since years, and currently he has been working head of department nephrology, Professor Rashid Sheikh. Sir, please come on stage. इनके लिए मैं यही कहूँगा कि सिंस स्टूडेंट लाइफ से हमको देखते हुए आ रहे हैं, हम लोग बड़े हो गए, इनकी शख्सियत सेम टू सेम वैसी ही है. और आज थर्ड चेयरपर्सन जिनको बुलाते हुए हमेशा मेरी दिल की धड़कन बढ़ जाती है, और one of the great pediatrician ever produced in the history of Hyderabad or in the history of Sindh, or we can say Pakistan. और आज जो भी कुछ मैं सीखा हूँ, थोड़ा बहुत जो मुझे पीस आती है वो उनकी वजह से है. और उन्होंने हमेशा मुझे कॉन्फिडेंस दिया कि थोड़ा सा जो है वो जो भी मैं सीखा हूँ. जो हमारे जो थर्ड चेयरपर्सन है, माय मेंटोर, माय बॉस एंड द प्रोफेसर ऑफ पीडियाट्रिक्स, इसरा यूनिवर्सिटी हैदराबाद, प्रोफेसर असलम अहमद. सर, प्लीज कम ऑन स्टेज. इनके बारे में एक चीज़ और भी मशहूर है कि इनके पास अगर कोई पेशेंट जाता है तो जो है वो इनकी प्रिस्क्रिप्शन में सिर्फ 1 या 2 मेडिसिन होती हैं, तो अल्लाह ताला ने इनके हाथ में बड़ी शिफा दी है. तो हमारी ख्वाहिश है कि हमेशा ऐसे ही हमारे साथ रहें. आमीन. सो आवर फर्स्ट प्रेजेंटर फॉर दिस सेशन जो है डॉक्टर हीरामानी लोहाना. She is associate professor in pediatric department and head of department at Aga Khan Hospital, Hyderabad. Dr. Hira, please come on stage for your presentation.
So prevention is better than cure. It is not a new saying. It is attributed to one of the philosophers in back 1500, and now it is the fundamental principle for modern health. The UK has a rich history of prevention, starting from the chickenpox vaccine. So prevention is basically defined as an actions that are aimed to prevent, eradicate and eliminate the disease. There are many levels of the prevention, starting from primordial prevention till slide change. So there are many levels of the prevention, starting from primordial prevention till the tertiary preventions, and all levels of prevention are extremely important. Sorry, can I come down because the slide taking is problem. Okay. Next slide, please. Isra, thank you so much, and sorry for G. So primordial prevention is basically the earliest modality of prevention, which is basically consists of risk factor reduction. For example, many adulthood disease like hypertension, diabetes, obesity have their origin in the childhood. So just by modifying the lifestyle of our children, just increase their physical activity, changing their diet, decreasing exposure of smoking in the adolescent, we can prevent adulthood disease. The aim of primary prevention is prevent the disease from ever occurring, and this can be achieved by immunization. Then the secondary prevention, which aim to the early detection of the disease, and this can be done by screening. In developed countries, more than 50 diseases are diagnosed at the time of birth just by neonatal screening program with a small drop of the blood. But unfortunately, in Pakistan, we don't have such programs. We have only program for the neonatal congenital hypothyroidism screening, which was initially started by Khan University in 1987, and then few years back this program is started by Sindh government, and only the institute which is doing the free of cost screening is the NICH. The tertiary prevention is basically early detection of the disease so that we can prevent the complication of the disease, and this can be done by rehabilitation. So why prevention is important than cure? The prevention is started than cure because it is the simple and easiest way than cure. It improves the quality of life. It delays the onset of the disease. It prevents the life-threatening complications, and it cuts down the cost. It also, by screening, we can prevent the hereditary disorders. So if you look at our country, Pakistan has a population of 32 million with 1.4 of Khani registered, and we are developing countries. So prevention is extremely important for the developing countries, because a resource-limited country can't provide services to 232 million population. So we have to invest on the prevention. If you look at the global mortality rate under 5, although the global mortality rate had reduced significantly from 59% from around 59% from 93 deaths per 1,000 live birth to 38 in 2021. But this progress is over the 30 years, means 2% per year. And still the number is high. In 2021, estimated 5 million children under the age of 5 died. And out of these 500, 2.5 million are newborns. And if you look at the causes of under 5 mortality after newborn period, they are malaria, diarrhea and pneumonia, which are easily preventable and treatable. This is the health status of Pakistan. Every year, we add 5 lakhs new cases of tuberculosis, making Pakistan the 5th highest country. Around 12 million people living with hepatitis B and C, making our country the worst country in the Eastern Mediterranean region. More than 250,000 children dies in first 28 days of their life. Our mortality rate is more than the other developing countries. Nearly 200 mothers childbearing age died, and which is making the maternal mortality rate highest in our region. Pakistan had reported 3.5 cases of malaria in 2022. Pakistan had an extremely direct resistant typhoid with around 40,000 cases reported from the 2 countries, and we have reported first case from our city Hyderabad. We had the largest outbreak of HIV, which is not related to mother and newborn transmission. Our stunting rate is 4 out of 10 our children are stunting. So if we look at the common childhood disease which are preventable and which are the reason for high mortality and morbidity in children are pneumonia, diarrhea, malaria, tuberculosis and malnutrition. Pneumonia is the leading infectious cause of death among children, which is killing around 7 lakh children per year. And these deaths are strongly related to undernutrition, lack of safe water and sanitation, indoor air pollution, and inadequate access to the health care. In many parts of the world, every second we are losing the child with pneumonia, and the disease is entirely preventable and can be easily treated with antibiotics. 99% of pneumonia deaths in children are under 5 are in the low and middle socioeconomic countries, and we can see here. Diarrhea is the second cause killer of the young children. In 2019, the diarrhea killed approximately 480,000 young children across the globe, which is around 9%. And the interventions are simple: ORS and zinc. Approximately 70 to 90% of the days caused by acute watery diarrhea can be prevented by ORS, and around 11.5% morbidity can be reduced just by adding zinc. Malaria is the third most killer in the children between age of 1 month and 5 years. In 2019, approximately 270,000 children under the age of 5 died of malaria, and every 2 minutes we are losing the case child with the malaria. Again, if you look at the interventions, so simple. Just providing the mosquito net, rapid diagnostic test and availability of anti-malarial, we can save this deaths. Tuberculosis is the disease that the world knows how to prevent, how to treat. Instead of this, over 600 children under the age of 15 are dying from it. Most of these diseases occur among the children under the age of 5. And 96% of the children who died of the tuberculosis have no access for the treatment. The major challenge is the malnutrition. The malnutrition consists of stunting, wasting, obesity and micronutrient deficiency. Stunting, although has declined from 2000, but we need a faster progress to achieve the 2020-2030 targets. Wasting persists at an alarming rate, and overweight will require a reverse in the path if we really want to achieve 2030 goals. Nearly half of all deaths under the 5 are due to malnutrition, because malnutrition puts children at a greater risk of infections from the common diseases and increase the frequency and severity of the disease, and also delays the recovery from these diseases. Not only the macronutrients, but the micronutrients is again a big problem. 28.6% of our children are living with iron deficiency anemia. 18.6% have a zinc deficiency. More than 50% have a vitamin A deficiency, and out of them, 12% have a severe deficiency. Vitamin D deficiency is again a big problem. According 62% of the children have a vitamin D deficiency, and out of these, 13 have a severe deficiency. 15.7% of our children with the age of 16 to 12 have a low iodine. These micronutrient deficiency are associated with undesirable short and long-term effects. They impair physical development and cognitive impairment. They increase the susceptibility to the infections. They are associated with a higher morbidity and mortality, and in the end, they decrease the productivity later in life. And this is the nutrition status of Pakistan. We can see 40% of our children are stunted, 17.7% are wasted, around 29% are underweight, and 9.5% have obesity. So how can we prevent? We know the issues, but how can we prevent? The solutions are very simple, and the solutions are proven. Breastfeeding is the #1 intervention for all causes of under 5 mortality and morbidity. When we talk about the breastfeeding, we have to focus on the 3 things: early initiation of the breastfeeding, exclusion breastfeeding for the first 6 months, and the continuation of the breastfeeding for the 2 years. Around 45% of our children, just 45% receive early initiation of the breastfeeding. And this is the status. According to the National Nutrition Survey of Pakistan 2018, 48% of our children exclusively breastfed till the 6th month, and only 56% continue breastfeeding till the age of 2 years. Early initiation of the breastfeeding and continuation of the breastfeeding till the 6th month can prevent neonatal deaths by 20% and under 5 mortality by 15%. This is not just in the developing countries. The recent study done in the USA, which is published in the Lancet 2022, have also proven that there is a significant association between the initiation of the early breastfeeding and the postnatal neonatal deaths. The second important thing is the immunization vaccines, which are low cost and a high intervention that can raise the health status of the country, because the low immunization is associated with the many problems like persistence of the polio, like increase the prevalence of the preventable diseases. So if we have to achieve the goal of 2020-30 Sustainable Global Goal 3, we have to improve our immunization. This is the immunization status of Pakistan. This is the survey which was done by the third party, and this shows that 76% of our children are fully immunized, 17.7% of our children are partially immunized, and 5.9% of the children have not received immunization. And this is the distribution of the province-wise. The Balochistan has a lower immunization coverage. If you look at our province, our 60% of the children are fully immunized. So because of this, we are unable to eradicate the polio. Unfortunately, this year in February, we have reported 1 case of polio. And we are one of the 2 countries who are still unable to eradicate the polio. The second country is Afghanistan. Unfortunately, I just received a message from GS Pakistan that 1 case from Afghanistan last night was reported to have a polio. The only period for the Pakistan was 14 months where we did not receive any case of the polio. If you look at the global immunization, every year 4 million children can be saved just by immunization, and we can increase this number to the 50 million by immunization during the year 2021 and 2030. It is estimated that by 2030, measles vaccine can save 19 million children and 14 million people can be saved by hepatitis B and C vaccine. There are 25 safe and effective vaccines that can protect health, that can prevent even the outbreaks of the disease. And out of these 14 vaccines, 12 vaccines are available in the program of Pakistan, which is provided by government of Pakistan free of cost. Being a healthcare provider, we just have to promote our routine immunization, and we also have to promote the supplemental immunization activities. The third important thing is the nutrition. The right nutrition at the right time is essential for everyone and every child, and it's the right of every child. What, when, and how children are fed, particularly in the first 2 years, is extremely important for their development and survival. We know well-nourished child have a more equipped to learn, are the productive member of the society, and respond well in disasters and even the global crisis. On the other hand, the malnourished children have a lot of effects on the health, education, and well-being that runs through the generations. In the nutrition, we have to focus on the 3 things in the first 2 years of the life. Breastfeeding, we already talked about, complementary diet, and the micronutrients. Age-appropriate complementary diet is an essential addition to the breastfeeding. Quality complementary feeding is measured using 3 indicators. One is minimum dietary diversity, minimum meal frequency, and minimal acceptable diet. Unfortunately, we are below in all indicators. And this is the report. Our minimum dietary diversity is 14.2%, minimal meal frequency is 18.2%, and minimal acceptable diet is just 3.6%. So if we have to improve these indicators, we have to give nutritional fatwa to every mother at the age of 6 months. दुनिया पता नहीं कहाँ पहुँच गई. अगर हम अपनी कॉम्प्लीमेंट्री डाइट को देखें तो वो दूध बिस्किट, ग्लूको बिस्किट और दूध से स्टार्ट होती है. 4 चीजें जो है ना हमारे बच्चे खाते हैं, साबूदाना, सेरेलैक, खिचड़ी, दूध, बिस्किट. With these we cannot promote our health. So every mother should have a nutritional fatwa at least at the time of start of the complementary diet. We have to tell them what's the frequency, what amount should the child have, what should be the texture. We have to promote them. They should take a variety of the food that include the balanced diet, and there should be active participation of the children. आप लोगों ने अपने घर में इधर-उधर देखा था, बच्चे को 6 महीने के बच्चे को लेटाते हैं, दोनों हाथ पकड़ते हैं, ऊपर से हाथ रखते हैं और स्पून के साथ खिलाया जाता है. So this is a wrong practice, and they have to maintain the hygiene. If we do this fatwa, we will prevent the micronutrient deficiencies. And the other strategies to prevent the micronutrient deficiency are food fortification, micronutrient supplementation, and the global public health and other disease control. बच्चे बीमार नहीं होंगे तो malnourished भी नहीं होंगे. And the fourth important thing is the clean water and the sanitation. Clean drinking water, safe sanitation, and a good hygiene protect children from a deadly disease. Not only from the deadly disease, but it can also prevent the transmission of polio. Just by providing the safe water, we can decrease the burden of infectious disease by 70%. The fifth important thing, the cost effective, is the hand washing. Hand washing is the single most effective way to prevent any spread of the communicable diseases. It is a cost effective public health measure and it is crucial to protect against a range of diseases, not only the communicable diseases. It is validated, and if validated and standardized prevention strategies applied, we can prevent hospital-acquired infections by 50%. But the fact is that around half of the hospitals have no hand washing facilities where the patients are treated. 2.5 billion people have no hand washing facility at their homes, and almost half of the schools don't have a hand washing facility. We have to promote this 5 movement of hand hygiene in every year, especially where the patients are treated. The 2 are before touching, one is before touching the patient, before any procedure, after touching the patient, after touching the surrounding of the patients, and after exposure with the body fluids. This is extremely important. And these are the simple steps that will just take our 20 to 40 seconds. Our 40 seconds can prevent the 40 years of someone's life. So how can we achieve these interventions? These are very simple, and this can be achieved by health education. Apple in a day, keep doctors away. And this prevention should be done at every level, at the primary level, at the secondary level, at the tertiary level. But the most importantly is at the primary level, because it is the function of the primary health care. If you look at the component, the first component of the primary health is the education on the health problem and how to prevent them. But unfortunately, we are facing a lot of challenges. We have a weak governance in the health sector. We have a low financial allocation for the health budget, and out of these, just less than 20% is invested on the prevention methods. We have an inadequate access to the universal health coverage and equality of care. We have a lot of crises in the health care, and we have a frequent health emergencies. So, to improve the health system, we don't need new hospitals. We just have to strengthen the existing hospitals and the centers. There are many simple fixes. The first is health should be discussed in the context of national security. The second, we can't control the health until we will not control our population. Third, we have to work on the safe drinking of the water and the sanitation. And the fourth, we must address the immunization and the malnutrition. And the fifth, we need to provide the public health to the poor people. Thank you so much.